One thing that catches a lot of new Medicare beneficiaries off guard is discovering that medical care in retirement comes at a significant expense. Even though you've paid taxes throughout your working years, those taxes only cover a portion of your Medicare benefits. In today's video, I'm going to walk you through what Medicare will cost in 2026. Every year, Medicare reviews and updates its premiums, deductibles, and copays. These numbers tend to inch upward over time thanks to inflation and the rising cost of healthcare in general. And 2026 is shaping up to follow that same familiar pattern. Before we get rolling, be sure to grab our free guide at the end of this video. It lays out all the 2026 figures in one easy place. Let's start with Medicare Part A, which is your hospital insurance. For the vast majority of Americans turning 65, Part A comes with no monthly premium. Those FICA taxes that were taken out of your paychecks all those years are what prepaid for your Part A. If you have at least 10 years or 40 quarters of work history, or you're married to someone who has those, you qualify for premium-free Part A. You can also qualify through a former spouse or a spouse who has passed away, as long as they met the same work requirements. Roughly 99% of beneficiaries won't pay anything then for this part of Medicare. For those who don't qualify, though, the buy-in premium is $565 a month in 2026. There is a reduced premium for folks who work between 30 and 39 quarters, and that amount will be $311 in 2026. Each part of Medicare also has its own deductible, and Part A's deductible is tied to a benefit period rather than a calendar year. This means you could pay it more than once in a year if your hospital stays are spaced far enough apart. For 2026, the Part A hospital deductible is $1,736. Now let's move on to Part B, which covers your outpatient medical services. Part B does come with a monthly premium, and if you're drawing Social Security, that amount is deducted from your checks before it ever even hits your bank account. And if you haven't started Social Security benefits yet, you'll receive a quarterly bill, or you can set up Medicare Easy Pay on Medicare.gov. Most people pay the standard base premium, which will be $202.90 per month in 2026, but some pay a different amount based on their income. There are programs that help people with very low income to pay for their Part B premium. And on the other end of the spectrum, about 7% of beneficiaries pay more because of higher income. This extra charge is known as IRMA and simply means that higher earners pay a higher Part B rate. For 2026, IRMA affects individuals with income over $109,000 or married couples with income above $218,000. There are 5 income brackets, and people in the highest bracket will pay more than $680 a month for Part B. The IRS sends your tax information from 2 years ago over to Social Security, who then uses that to set your premium for the coming year. You'll receive a benefit determination letter in the mail showing your exact amount for the coming year. If you recently retired and you're now earning far less than you did 2 years ago, you can file a reconsideration request with Social Security, who can adjust your premium. We have a video for our clients that walks them through that process of appeal step by step. Part B also has an annual deductible, and for 2026, it will be $283. Now let's take a look at Medicare Part D, which covers your outpatient prescription drugs. More than 50 million people rely on these plans. You enroll in Part D by choosing a plan offered by an insurance company in your state. Premiums can range quite a bit. Some are under $1 a month, while others are over $200 a month, depending on the plan and where you live. The national average Part D premium for 2026 is estimated to be around $34.50 a month. And just like Part B, higher earners must also pay an IRMA surcharge on top of that. And don't forget, Part D also has an annual deductible set by Medicare. In 2026, the maximum deductible will be $615, although plans are allowed to set a lower amount. Keep in mind that the lowest premium or lowest deductible doesn't always mean the lowest total yearly cost. What really matters is whether the plan covers your medications at the lowest copays throughout the year as well. That's why the Medicare.gov Plan Finder is so valuable when you're choosing a plan. Here at Boomer Benefits, we guide you through the initial Part D analysis for free for anyone who gets a Medigap or Medicare Advantage plan through our agency. Part D works a little differently in 2026 because of recent changes in the law. There are now 3 stages of Part D that you will move through each year. You'll start in the deductible stage, then you shift into initial coverage, and finally, you may reach catastrophic coverage. And here's the good news. Thanks to the Inflation Reduction Act, there is now a lower cap on what you'll spend out of pocket on your medications. Once your total drug spending hits $2,100 in 2026, you move straight into catastrophic coverage and you'll pay nothing for the rest of the year on covered medications. For many folks taking expensive medications, the change brings real relief and a lot more predictability in their budget. Now, let's talk about Medicare Advantage or Part C. These plans vary a lot in cost, and some offer $0 premiums because Medicare pays the plan to take on your medical risk. Advantage plans also include a maximum out-of-pocket limit to protect you. Once you hit that limit, the plan picks up the rest of your Medicare-covered A and B costs for the year. Insurance companies can set that limit lower than Medicare's ceiling, but they cannot set it higher. For 2026, the highest allowed maximum out-of-pocket for in-network care will be $9,250. If your plan includes out-of-network benefits, that amount may differ, and your drug spending is also separate and additional. It's very important to look at the maximum out-of-pocket every year and make sure you could afford to spend that amount in a year of high medical usage. So that gives you a clear picture of what Medicare will look like in 2026. Whether you're brand new to Medicare or you've been on it for a while, understanding these updates can really help you plan ahead and avoid any surprises. Some people find these changes reassuring and others may feel the pinch of it, but knowing the numbers is always the first step toward making smart choices. I'd love to hear your thoughts, so drop a comment below and tell me what you think on these new numbers for 2026. And if you'd like help reviewing your current coverage or exploring options that might save you money, give our team a call at 817-249-8600. You'll get that old-fashioned customer service that your parents enjoyed back in the day that you may remember. And as always, our help is completely free. Thanks for watching, and I will see you in the next video.